This is yoga, meditation, and cannabis as alternative treatments for people diagnosed with bipolar disorder. I'm Esther Shaw, and I'm a 200-hour registered yoga teacher. The table of contents provides page numbers for each section included in my presentation. First, I'll give a scientific description of what you already know, that bipolar disorder really sucks, and why you should care about alternative treatments. The cause of bipolar symptoms is a malfunction in the clock genes, which creates a circadian rhythm dysfunction. A lack of sleep can often trigger a manic episode. It's also tied to an overactive adrenal response, also known as the fight or flight response. The medical burden of bipolar disorder is quite severe. You're twice as likely to suffer heart disease and stroke, and often you have 4 times the medical cost. In addition, there are chronic cognitive and executive function impairments that people diagnosed with bipolar disorder have to deal with in their daily lives. There are many issues with traditional treatment. First is that there is a severe power imbalance between caregiver and care seeker. Psychiatrists can often require medication compliance, and if patients don't comply, they can be fired as a patient or sent to the mental hospital, which can be psychologically very traumatizing. In addition, side effects of medications are directly related to the medical burden. Weight gain is related to heart disease and stroke. Neurocognitive deficits are linked to anti-anxiety medications, and bone density loss is associated with long-term usage. In case you haven't been told recently, you're a human being and you deserve to be treated holistically. And there are quite a few alternative treatments your psychiatrist probably didn't tell you about. 3 treatments are evaluated in this presentation, including yoga, mindfulness-based cognitive therapy, or MBCT, and cannabis. The criteria of investigation are safety of use, especially in perinatal women, that is, women who are thinking about becoming pregnant or breastfeeding, reliability of data, and the all-important efficacy of treatment. What follows is a brief discussion of methods, results, conclusions, recommendations, and finally, references. So I used ALCEC library databases to perform secondary research. Preference was given to current articles. Results for yoga returned 2 experimental studies in which patients with generalized anxiety disorder were treated with the Shuddhashara Kriya. Unfortunately, neither study talked specifically about safety of participant usage, and so I included Desikachar's The Heart of Yoga as a source to comment on the safety of yoga. Desikachar, a renowned yoga therapist, says that as long as yoga is done with modifications to the individual, it is perfectly safe. Results concerning reliability of data showed that both studies were open-label studies characterized by small sample sizes. There were pre- and post-test analysis of both observer and self-report scales. In respect to efficacy, both studies showed positive results. Katzman et al. Demonstrated statistically significant reductions of scores on 2 self-report anxiety measures, while Doria et al. Demonstrated statistically significant reductions in scores on depression and anxiety measures. Desikachar, of course, has had great feedback, and his Institute of Yoga Therapy is actually recognized by India's Department of Health. Results for mindfulness-based cognitive therapy returned 2 studies, Parekh et al. And Milkowitz et al. Unfortunately, neither specifically discussed safety of usage. Because of this, I included Desikachar's The Heart of Yoga as a great source to comment on the safety of practice of yoga and meditation. He says that as long as yoga and meditation are done with modifications to the individual, that they're safe. Results for reliability of information for mindfulness-based cognitive therapy include Parrick et al.'s 12-month MBCT randomized control trial in which researchers were double-blind at pre- and post-test, which included both observer and self-report scales. Milkowitz et al. Was an 8-week program with perinatal women and was characterized by a small sample size and high dropout rate. Also, researchers included observer and self-report scales in their analysis. Results observed by Parrick et al. Included lower scores of the MBCT group versus control on anxiety and achievement scales. Achievement scales measure standard setting, or how difficult you are on yourself. Milkowitz et al. Demonstrated an improved mindful tendency in perinatal bipolar participants, and Desicachar's efficacy was recognized by India's Department of Health. Results for cannabis returned 2 studies, neither of which specifically discussed safety of use for participants. Because of this, I included an article written by general practitioner Emily Baines, who says that cannabis disrupts levels of anandamide in early pregnancy. Results for reliability of data of cannabis returned that Braga et al. Was a controlled trial in which participants underwent a battery of psychological testing to confirm bipolar diagnosis, and then, after inclusion in the study, underwent a neurocognitive battery just 1 week later. Tyler et al. Utilized an experience sampling method. The study lasted 6 days. Results indicate that cannabis is effective. Braga et al. Observed that bipolar participants who are diagnosed with cannabis use disorder outperformed cannabis-free participants at a significant rate on 4 neurocognitive measures. Tyler et al. Observed that cannabis relationship to mood is variable and promotes positive effect. This may suggest that cannabis acts as a mood stabilizer. In conclusion, yoga and meditation are the safest alternative treatments included in this report. Cannabis is the riskiest. This is because it can cause miscarriage and ectopic pregnancy. In addition, cannabis is not legal or medical in every state. In respect to reliability of data, studies on yoga featured moderate experimental design. Studies included on MBCT featured moderate to strong experimental design, and studies included on cannabis featured strong experimental design. All 3 treatments were found to be effective. Decreases in anxiety and depression were observed when yoga was used as an alternative treatment. Decreases in anxiety, depression, emotional coping, and achievement scales were observed when mindfulness-based cognitive therapy was used as a treatment. And increases on neurocognitive measures were observed when cannabis was used as an alternative treatment. When first starting a yoga and meditation practice, you may be unsure of how to stay safe. If this is the case, refer to Figure 11, How to Practice Yoga Safely. Or you might be unfamiliar with which kind of practice would be best for your energetic state. If this is the case, refer to Figure 12, Recommendations for Balancing Mood with Yoga and Meditation. Because you'll need some additional instruction, you can Google local studios, teachers, or yoga therapists. I recommend that you practice daily and that you practice with others. Always listen to your inner teacher. Paying for practice doesn't have to be complicated. Most studios offer unlimited memberships, which can cut down on the cost of an individual class. Many often have work trade systems in which you perform mild janitorial duties for free classes, or you could always barter with any unique skills that you may have. In addition, there are free classes online on YouTube, just in case you're snowed in. As far as cannabis goes, if you're living in a non-legal, non-medical state, cannabis is not recommended. In addition, if you're pregnant or nursing, cannabis is not recommended. If, however, you are living in a legal state and you would like to try cannabis as an alternative treatment, you can begin by Google searching for smoke shops. Membership may be required for purchase. Use as you need, and edibles are probably healthier for your respiratory health. If you're living in a medical state, you're going to need to talk to your doctor first and obtain a medical card. Use only as prescribed, and if you're feeling sciencey, you can keep a record of each strain tried. You can pay for cannabis by checking smoke shop sales or by growing your own. I'm going to go over some additional safety guidelines for yoga and meditation before jumping into the infographics. I also call this listening to your inner teacher, which is a phrase that you'll hear a lot in classes if you begin to take them. So I think you should always warm up before stretching. Try beginning postures first. Never go full out when learning a new pose. Stay away from advanced postures, especially when you're first beginning, and come out of anything that feels painful. Slowly and with control, of course. Focus on smooth and even inhales and exhales. If you have specific safety concerns, please use this chart to find guidelines for helping to ease your practice. So if you're pregnant, you're going to avoid inversions, handstand, headstand, downward dog, closed twists like revolve triangle, and prone poses like cobra. Rest often. You don't want to overheat your body. If you have issues with balance like high blood pressure, low blood pressure, or vertigo, use a chair or wall during standing poses if you're dizzy. Don't raise your arms above the head. And if you're transitioning to and from the floor, take a few extra breaths and be very careful. If you're overly flexible, so you have a tendency towards hyperextension, you can draw your limbs into the center line. Allow for a soft bend along the joints at all times. If you're especially inflexible, you can make smaller movements in postures. There's no shame in bending your knees in forward folds and using a blanket, perhaps underneath, to support. You can also use props like blocks and straps to extend your reach. If you don't have any safety concerns, remember the previous slide and listen to your inner teacher. This infographic focuses on recommending certain types of practice dependent on mood state. So you're always going to kind of want to balance out your mood. If you're depressed, you're going to do an energizing and uplifting practice. You can try some sun salutations after a slow warm-up, back bends and laterals. Emphasize the inhale. Meditate on the sunrise, a strong tree, or a mountain summit. If you're also anxious, do fewer back bends and don't meditate on the sun. If you're anxious, you can practice standing balancing postures, laterals, and twists. Focus on slow and even inhales and exhales. Meditate on the mountains, a strong tree, the healing moon, or a positive self-affirmation. And finally, if you're manic, you're going to want to start by shaking off some of that energy and then practicing some moon salutations, forward folds, hip openers, and seated stretches. Focus on your exhale. Meditate on a cooling shower, a refreshing stream, or a starry sky. If you're anxious, add self-affirmation practices like I'm supported in this space. These are references given in APA format for information included in this presentation. I want to thank you all for listening and giving me your time. I hope you enjoyed this presentation as much as I enjoyed researching and putting it together. Thank you so much. Again, I'm Esther Shaw, and I am a 200-hour registered yoga teacher.